Hi, my name is Chris, and I'd like to take a few minutes of your time to talk about proper selection and use of a stethoscope. You have many choices when choosing a stethoscope. The first is it a dual lumen or a single lumen stethoscope? I highly recommend the single lumen for you beginners, as it's going to be much easier for you to manage the stethoscope as you're learning. A good length is about 20 inches, not too much shorter than that, and that'll give you nice ergonomics as you're taking blood pressures. The next choice you have is whether it's a single head or a double head. The double head is the stethoscope that gives you a choice of hearing out of both sides. This can cause some confusion for beginners, and so that's why I highly recommend keeping a stethoscope initially with just the single head. Now I'd like to talk a little bit about the anatomy of a stethoscope. There are essentially three parts to the stethoscope. You have the earpieces, you have the lumen, the plastic tubing, and you have the diaphragm. And the diaphragm is made up of really three pieces. You have the plastic diaphragm itself, which is a simple piece of round plastic. You have the head of the stethoscope, which is a concave shape. And you have the retainer ring, which holds the diaphragm in place. Every so often you want to check the diaphragm to make sure that there are no cracks or tears and that it's operating properly. Proper fit of a stethoscope is very important if you're going to hear what you need to hear out in the field, especially in the loud environment. Earpieces are the most critical part of that. The earpieces need to fit snugly inside the ears and block out the outside noise. They also need to be adjusted properly because your ear canals face forward in your skull, and the earpieces of the stethoscope need to fit in there in the same direction. As you'll see, these are pointed slightly forward, like out towards my nose, and so when those go in, they're going to block the ear canal and you'll be able to hear as best you can. One of the most important things you need to do when taking a blood pressure or using a stethoscope to take a blood pressure is you need to locate the pulse point with your fingers first. That's called palpating the pulse point. Using the pulse point in the arm here, it is on the anterior side of the elbow on the medial aspect of the arm, approximately in this area. Don't do what many people do, which is just place the stethoscope in that area, because you're not going to ensure you're directly over the pulse point. We want you to actually palpate the pulse point, take your time. Once you've located the strongest point of that pulse, that's the location you're going to place your stethoscope. That's going to ensure the best opportunity to hear the blood pressure in a loud environment. In our next segment, we'll talk a little bit about how to use a stethoscope to assess breath sounds. Until then, be safe.